Hi, I'm Eileen, and this is another movement education video for Move Without Pain. And today I want to talk with you about back pain, a little bit of specific, a little bit of general. I do have several videos out there, common causes of back pain when sitting, when standing up, when bending over, when bending backward, when turning. I've got a lot of videos, aiming at specific movements. But today I want to talk about, this is probably something that you've never heard before, but there's how healthcare treats back care. It's interesting because, I've been in my profession now for going toward 30 years. And if you look at the data and you put it on a pie chart, 70% of the people who have low back pain, there's no diagnosis. It's unknown cause. So the diagnosis will be low back pain. There's no, you've got 3% where it's real serious stuff, maybe a fracture, God forbid, maybe cancer, something else really serious going on, right? And then you got 27% where there's a definitive reason, at least assumed via the imaging. Maybe there's a disc issue, maybe there's, degenerative disc disease, and maybe there's a herniated disc, but there's kind of a rhyme or a reason. But 70% of people who experience low back pain, it's unknown cause. So we've got this thing where, we want to use evidence-based medicine and we want to make sure that we're doing things that are helping people. However, since each person is very unique, like a fingerprint, and they've got a whole different personality, activity levels, how they fed their body, any injuries, were they in sports, were they sedentary, what's their job, what's their hobbies, are they right-handed, are they left-handed, are they spending a lot of time doing some specific thing? Everybody's unique, right? Trauma histories and their whole mindset on how we're supposed to age, whether they believe I'm going to age well or they believe, oh, as I get older, I'm going to fall apart. I mean, all those things really impact somebody, right? Their whole life. So every person's like a unique fingerprint. I could have 3 people walk through the clinic door with the exact same diagnosis and present with the exact same symptoms, yet need 3 completely different plans of care to resolve the issue, because each person is unique and individual. So when it comes to back pain, there are a million videos. I can't even count them. There's countless videos on YouTube that will show you things for back pain. 3 best treatments, resolve your back pain now, all this kind of crazy stuff. Well, you're a unique individual. You're your own fingerprint. Who's to say that exercise or that stretch that somebody's showing you is going to help you? It might actually hurt you. You don't know, right? So what I want to talk about here, and I am going to show a couple of movements, so bear with me, but I want to really, really reinforce the idea that the low back has problems more often than not. If it's that 70% of unknown cause, more often than not, it's not the low back. You could ignore the low back to fix the pain. And I'm sure this is not mainstream knowledge, and you may have never heard this before, but if you're in that 70%, more than likely, it's not your low back, it's not your lumbar spine, which is, between your trunk and your pelvis, right? You've got 5 vertebrae, and L1 through L5, and guess what? That body part probably doesn't have anything wrong with it. It's screaming out for help because there's other areas of the body that are not working right. And so it's getting stressed and strained every time you use it. Your low back can be the strongest link in your body if, when you're training your body, you are feeding it from other areas of the body that need to work properly. So that said, a huge area of the body that impacts low back is hip. If your hips are not working properly, if they're impaired, if you've got psoas that are locked short and tight, if you've got glutes that are weak and flaccid and have lost strength and size, you know, kind of a pancake butt. And I say that lovingly. But if you've been sitting on those muscles for 20, 30, 40 years, you know, you're a truck driver, you're a cab driver, you're a bus driver, you're an office worker that when you go home, you're sitting as well. Those muscles have lost proper function. And that's not the low back. But the low back can be stressed and strained because those muscles aren't working right. So I'm going to show you a couple of things that can work on those areas. The most common reasons that the hips can impact the low back. Train those hips a little and see if your low back doesn't feel better. Okay? So one of them is just doing squats. Just get the power source awake again. And so, and you can do them very, very safely. If your knees don't, you know, if you've got one knee that's not happy, you can kind of protect that knee. And I'm going to show you a couple of things. So just kind of pretend this is a chair that I'm holding on to, right? Or the kitchen sink, okay? You want to have a chair behind you because you want to have a target for the power source to aim at, right? Kind of like your bottom is a seeking missile. And you want to keep your knees back against the chair so that when you squat, you're not doing this. Now, that's not a horrible thing to do because if you're bending down to pick something up, you're not worrying about if your knees are going over your toes. The reason you don't want to do it for this purpose is because when your legs go forward this way, the quads are working more, right? And we're not trying to strengthen your quads, we're trying to strengthen your glutes. So, and your hamstrings, and get the back side of the body working better, right? Especially if you're sitting on it all the time and it hasn't really worked. So you want to keep your knees back, hold on for safety because you might lose your balance, especially if you've got weakness, a lot of weakness there, and go back with your bottom, keeping your knees against the chair. If the knees go forward, you know, pretend it's a game show, right? And so you want to have your bottom go back and come down toward the chair. The goal is to get your bottom as low as it can go without losing your balance, and then push back up through your feet. Even if you're holding onto the kitchen sink or you're holding a chair in front of you or a counter, right? Only go as low as you can go and come back up without losing your balance. Now, if you can go all the way down, keeping those knees back against the chair and come all the way back up, it's probably not your power source. Most of you are probably going to find out that you get about here and you're like, whoa, right? If you're not even holding on, you might lose your balance. But really make sure those knees stay back because you want this part of the body to regain that lost strength. Another very, very common reason that people have low back pain is because the psoas, the front of the hips muscles, the hip flexor, the muscle that shortens when I do this, right, with all the sitting, it's just gets short, it locks tight, and it just doesn't want to get longer again when you go to sit up. You're sitting at a desk all day long or you're driving a vehicle all day long. And so it gets really used to you sitting, it gets really used to being shortened, and then when you go to get up, you're like, oh, right? It's because those muscles are locked short, and they don't want to get nice and long and allow you to be up nice and upright. So what you want to do is you want to get those muscles back to getting longer again and working properly so you can stand up nice and tall without pain, right? So you can do a few gentle things, because if that really is your biggest issue, that you're kind of like this because they don't want to get up, you don't want to try to just rip them. They're not going to like that, okay? So what you want to do is you want to create this nice repetitive sort of a fluid fill effect. You're just going to get this nice, you know, where it's happy, it's not mad at what you're trying to do, and it can do it. So you might have to do just a little tiny bit of something where you just put one foot forward. So now this hip here has to extend, right? And just try to come forward a little bit like this. So my knee obviously is taking the brunt of that. And so you want to make sure your knees are okay to do this, but keep that hip, you know, extended, keep that knee straight, keep that heel on the floor, because if you do this, now the hip's not getting longer in the front, right? So do this, and just kind of see how it tests the waters. Test the other side. See how that feels, right? You want to just kind of wake it up a little bit. Now, you don't want to come forward with your upper body too much, because now if I come forward, say this is the hip I'm working in the front, and I come forward, what happens? It's not really extending, right? It's not getting longer because I'm shortening it by coming forward. So you do want to try to keep things back. You can hold on to something if that makes you feel safer, right? I can hold on, and I can do it this way and try to keep your head and shoulders back and up. And that's going to get that working. And of course, you want to do both sides. Now, there's a lot more progression you can do, but I'm reluctant to show you any. Oh, sorry. I meant to put that one back. I don't want to show you too much progression and have you hurt yourself. But do know that those psoas, they attach to T12 through L4, so they're attaching to the whole lumbar spine. And guess what? They really need to work properly so you can stand up nice and tall, you can extend back, you can have a nice stride when you're walking. It's really, really important. So a lot of times, low back pain is caused by something else, and that 70% of that pie chart, exact cause unknown or cause unknown, it's usually because there's some area of the body that's not working right. That's not the low back. It's the hips. Could be the trunk, right? Could be ankle's not working right, and it's throwing everything off. But the hips are the most notorious. The thoracic spine is the second most notorious. And so if you have trouble rotating, if your thoracic spine doesn't do a nice flexion and extension, it doesn't do a nice side bend, then guess what? When you go to do movements that require that, the low back is getting trashed as well. So I just really wanted to put this out there because a lot of people just, they go after the low back. They're looking for everything they can do for the low back, all these low back stretches and all these low back things that they do. But if the problem is the power source has lost power, the hip flexors don't get longer, they're locked short and tight, you can treat the low back until the cows come home, but you're not going to get rid of the pain. So I wanted you to know that, all right? Okay, I hope this helps you. I am going to be doing a 3-day Move Without Back Pain challenge. So hopefully you might want to sign up for that and check it out. You're going to learn a lot about backs and, common treatments, risks, benefits, some movement training, and a lot of questions answered. So I hope you'll join me. All right, I'll see you next time.